This morning, we're joined to discuss all of that matter by Professor Oyewale Tomori, who is the Regional Virologist with the World Health Organization, the former Vice Chancellor, Redeemers University, and the President, Nigerian Academy of Science. Thank you for coming on this morning, sir.
It's a pleasure. Thank you very much.
Well, so much. I mean, we've done so much. I mean, one of the headlines today is that one more Nigerian patient is due for discharge. And I mean, you've monitored all that we've been doing, if not most of it. What's your assessment of how we're handling this?
I think we're doing well. We're doing quite well. Although one would need to say that detecting the first case was not because we were prepared. Circumstances made it what it was. Sawyer was sick on arrival. He was taken through the VIP and not through the main public thing. Our doctors were on strike, so he couldn't go to a general hospital, and he went to a private hospital. And he couldn't get all the way to Calabar. So all those circumstances made things fortuitous for us to be able to contain into a very small area, his opportunity to spread the disease to other people. But after that, I think the government has done very well in monitoring all the cases, his contacts. I think up to today, there will be 300 contacts that have been monitored, and 100 of them have passed the period of incubation period, and action is still going on. I think what bothers one now is that we're getting people coming down with secondary contacts. That is a little worrying, but the way we handle the first cases, if we continue along that way, I don't think we should have anything to worry about.
What about your assessment in terms of our understanding the EVD itself? Because at that time, there's a lot of panic. We didn't know exactly how to go about it, how to prevent ourselves, and all of those kind of matters.
Yeah, I think it's always whatever happens when you have a disease like Ebola, even among scientists, because we don't really sure where the natural host is. People talk about fruit bats. People say the pigs have been infected in other parts of the world. People talk about wild animals. When you really look at Ebola is mainly a disease like you may call strange Hollywood kind of disease because of the panic that it causes. But that's natural. Lassa did the same thing. But all it requires is proper education. People are aware that like any other disease, Ebola also can cause what it's causing. I think the message we need to pass to our people is that diseases are always around all the time. New pathogens are coming up. You never know where they're going to come from. Therefore, the issue of infection control should be on all the time. Against those diseases, it's a matter of eternal vigilance. You can't relax. You have to be there because you don't know where they're coming from. You don't know what direction they're coming. You don't know through who they're coming. Therefore, you must be constantly, our colleagues in the health field must be constantly carrying out things that will protect themselves. Because if you look at some of the cases, a lot of health people get infected because they're the ones who get the first contact with a case of fever. You don't know what it is. And therefore, that's why it is important. Any case of fever that comes into any hospital, doctors, health workers must take action to protect themselves first.
I mean, you say that I think the secondary cases of people coming down worries you. Is it that is not supposed to happen, or what?
Ideally, if we contain the first set, then you limit the secondary contamination. For example, the primary cases that we had in Nigeria were contacts of soya. The secondary contacts will be contacts of those who contacted soya. So if you break the chain at that point, then you don't have secondary and you don't have tertiary. What makes it more difficult is the fact that now that you have secondary cases, you don't know where they have been. You know where the doctor who treated soya was. You know he's a family. But what of other family members who got into with him? Where else have they been? So that expands the story. And that's why the earlier you can stop it before it gets to that secondary stage, the better for everybody.
So, but I mean, do we really have cause to panic since we know that the people who got infected are secondary contact, or it was just one person, even though two were announced on Friday, it would seem one person has been cleared. They're spouses of the primary contact. Is that to be expected?
Yeah, because of the closeness.
Oh,
yes, it is expected. But the question is, where has that spouse gone to? Has it been to the market? Has it been to other people? At the time, if they do fall sick, have they contacted other people? And that means you're spreading it. That's what it is. And if we knew those who were, and people need to come out early and tell people that, yes, I have contact with these people. I think initially when this started, people were not that honest, let me put it that way, in saying, yes, I've had contact. The initial reaction was, oh, yes, we did what was right, until sickness proved them wrong. And these are some of the issues I think we need to look to. So we must appeal to people, if you ever had the contact with anybody who might have been in touch with somebody, then the earlier you tell people, the better. Otherwise, we're going to spread this thing all over the place.
You know, the picture painted before now is that the spread is limited. I mean, you don't stand a chance of being infected if you have a contact with someone who's not down with any illness. Does that still stand? It
stands. But then a spouse, between spouses, there must be contact. And if any of the spouse gets sick, then there must be some contact. You're also thinking of family members of such people. You use the same, maybe the same bathroom, the same toilet, whatever. And if one of them is sick enough to be able to vomit and bring all those signs of Ebola, then the chances of other people getting in contact within the family is increased.
Let's look at, let's go back a little bit here. Are there lessons that we could have drawn from countries like Uganda and Congo who've had these outbreaks many times before now that we were not paying attention to?
Let me, in fact, I'm glad you brought that up. Ebola has been occurring since 1976. It didn't become, WHO didn't declare it a global event of public importance, public health importance. Because over there, things were contained. Let me say one thing about us in West Africa. We seem to be a little more aggressive than our colleagues in Eastern Africa. When you tell the Eastern African that, because of the stay where they are, they stay there. I mean, you still have a few people who not. But come to West Africa, if you tell me don't go out there, I will ask you why. Why should I go there? Why should I not go there? And that's what happened in Liberia, in Sierra Leone and Guinea. First of all, there was a denial by the government that there's a problem. And then when the problem came, then people, I mean, you saw what people in Liberia ransacking a treatment center. These are some of the things that we differ from our own relationship with the guys in East Africa. When you tell them that there's a problem there, they keep to it. But in West Africa, we're a little bit aggressive, and that's what we're paying for, apart from the underlying problems of Liberia, Guinea, Liberia and Sierra Leone. After the war, their system was really down, and therefore Ebola coming on just came in to destroy whatever progress they've made since the war.
Even though some of us wonder, yes, the aggression notwithstanding, but we don't understand how they ransack a center that is supposed to be designated as such.
I mean, I don't know. Well, my president has described Sawyer as mad, but I would also want to use the same word with such people, because it's like knowing you have a danger there, and they've been told, I'm sure they've heard all sorts of stories, for people to go in there. But their reason is that they don't want that treatment center in their place, because they think that's where they're spreading it. But the approach is not to go there and ransack and steal the things that are contaminated. So again, people behave irrationally sometimes when you panic, and they may be trying to do something to save themselves, but in the process, they have actually created more problems for themselves. I'm
looking at the things that we did not do before Mr. Sawyer came into the country. I mean, for instance, we had that meeting in Ghana saying, look, we have to really be careful about this thing spreading along the West African coast. And then it was also in Congo all this while. So I'm wondering, the Nigerian Academy of Science, did they talk about this to who? Did they make that awareness to the country for us to be prepared?
Initially, as way back, I can't remember exactly when I actually wrote to the minister about the need for us to get ready. And I remember when he was going to his meeting before the meeting in Ghana, where all the ministers was called, I'd actually reaching to him, first in my personal capacity, but also on the name of the academy, that time has come for us to protect our border. The first point is protecting the border, because if they don't come in, then you don't have a problem in your country. And he did tell me that action has been taken. He's written out letters to the hospitals. Perhaps maybe we should have started with the border rather than with the hospital. And again, as I said, fortuitously, when Sawyer came in, he fell sick at the airport. If not, I think we would have been telling a different story, because that guy could have gone all the way to Calabar, could have been anywhere in this country and created a problem. But I think, yes, we did mention, and I think the minister did what he should do by writing to his colleagues I think the emphasis we should have had should have been at our port of entry, rather than, well, the hospital should have been prepared. But then if you don't get it in, then you can't begin to prepare the hospital, that kind of situation.
Because